from scottgraypt.com, and so today is Manual Therapy Monday, and I do want to talk about treating the thoracic spine. So we're not going to talk about treating the thoracic spine directly per se, but we're going to treat the ribs, which is its neighbor. And so as clinicians, a lot of times we go in and we treat this thoracic spine because it gets gunked down, and sometimes it's really good outcome, but a lot of times it's not so effective because a lot of times these ribs are not moving like they should. And so the ribs really are the arms of the thoracic spine. So they connect here, kind of off the vertebral body in the transverse process, and so when they're not moving adequately, this spine's not going to move. And so for instance, if I'm rotating my spine to the right, these ribs on the right actually need to glide backwards. Similarly, on the left, they need to glide forward. In a lot of cases, we need to work on thoracic spine extension, and these ribs actually need to kind of roll backwards and kind of gap back. So we're going to, in this video, show you a quick way to assess the rib mobility and then how to treat it to enhance thoracic spine mobility. All right, so now we're going to take a look at how to assess the rib mobility. And so it's similar to a PA mobility of the ribs, and so the ribs really kind of run at this angle. And so I really want to kind of take my pisiform and kind of find that angle of the rib just kind of lateral to the transverse process. And then I just want to do a little sink and spring, sink, spring, sink, spring. And I want to find where it's mushy. So here it's a little bit more firm versus here it's loosey-goosey. So I don't want to work there per se. I want to work these higher segments. So you can also take a look at the mobility of these ribs by gliding it upward. And I come down over at this angle here, and I'm just going to glide up. And so this would be used for an inhalation technique. And I'm just going to glide up, and glide up again. He feels kind of tight there. I can also come down this way and work on expiratory. So when he, as far as getting air out of the lungs. So this would be depression of the ribs. And I can sink, spring, sink, spring, sink, spring, sink, spring. In this video, now we're going to take a look at how we treat this. So just like the tests, we can also just treat it that way. So again, I'm just going to take my pisiform on that angle of the rib, and I can just kind of sit here and kind of glide down. That could be my grade 1s, 2s, 3s, 4s, and 5s. And again, I'm just going to stay right where he's at and just kind of oscillate on that rib. I can also then again come up here and glide up, and I can also block the transverse process on the opposite vertebrae to get more motion at that costovertebral joint. And then go that way, and then again I'll come back this way. Again, like this more. All right, so we're going to take a look at his rib mobility standing, and we're going to treat it with a thrust and see if it gets better. So Pat, cross your arms for me, and then go ahead and rotate to the right for me as far as you can. Okay, good. And then go back to the left. Good. You see he's a little bit better to the left. So we're going to actually thrust some of those ribs that were tight, and then we'll reevaluate to see if it improved. Hey everyone, this is Dr. Scott again, and so now we're going to do a grade 5 thrust over the approximately ribs 2, 3, and 4 on the right side, and we're going to see if that improves thoracic rotation. So I'm going to lower the table down. I've got Pat here in my V method. I'm basically just going to take my pistol grip here, come off of the side here, find the angle, and then make sure you have the patient breathe all the way in, and then blow out. And then, good, thrust, and then again, breathe in, breathe out. Good, one more. Breathe in and breathe out. There we go, good. And then go ahead, Pat, sit on up, see if that improved. Cross your arms, and then rotate right. And as you can see, you got a little bit better range of motion.